My name is Corporal Bradley Joseph Seitz.
Kate Weber.
Jerry Reed. Will Sanchez.
And I have PTSD.
I have PTSD.
I have PTSD.
So, post-traumatic stress disorder is a mental health problem that some people will develop after experiencing or witnessing a life-threatening event like combat, a natural disaster, a car accident, or sexual assault. So, PTSD is a result of trauma, and people began studying PTSD after World War I when soldiers came back from war, particularly after seeing the results of the development of new explosive devices and had trouble reintegrating into society and experienced mental changes after returning from the war. And the etiology of PTSD is different than a lot of other mental illnesses because the etiology is a traumatic event, and it's not as ambiguous as some illnesses. So, PTSD is a result of trauma, and a traumatic event is any event that threatens your life or someone else's, and so PTSD can be a result of direct experience of a traumatic event, but it can also be the result of witnessing a traumatic event, learning about the violent or unexpected death of a friend or family member, extreme or repeated exposure to the details of traumatic events. So that would be about like a reporter who studies a traumatic event for a very long period of time, or someone who learns a lot in really intense detail about a traumatic event. However, it does not include electronic media exposure. So it's important to note things like the fact that you cannot get PTSD from something like watching recording of the 9/11 attack, because that's not considered experience of a traumatic event. And so trauma is something that 60% of men and 50% of women will experience at some point in their lives, according to the U.S. Department of Veterans Affairs. And what normally happens is that it's normal to experience trauma, but PTSD is something that occurs when someone experiences trauma, but then, like, more than a month after the traumatic event, their symptoms from the traumatic event do not drop off. So this graph shows time after traumatic event, and usually for a person who experiences it and has a typical reaction, they will experience PTSD-like symptoms right after the traumatic event while their body and mind recovers, but then those symptoms will drop off as they recover and return back to normal. Whereas with PTSD, those symptoms will last for longer, but then usually also for someone who is able to recover, those symptoms will eventually drop off. And then with chronic PTSD, those symptoms might never drop off. So PTSD is something that around 7 to 8% of people in the US are likely to develop in their lifetime. And according to the U.S. Department of Veterans Affairs, about 15 out of every 100 Vietnam veterans were currently diagnosed with PTSD at the time of the most recent study in the late 1980s, and then another 15% or 30% were estimated diagnosed at some point in their lifetime, but then 70% were never diagnosed with PTSD. Then with Gulf War, or Desert Storm, about 12% were diagnosed with PTSD, and with the most recent wars with Operations Iraqi Freedom and Enduring Freedom, about, well, the estimates range from 11 to 20% for people who have PTSD after serving in those wars. And so, according to the World Mental Health Surveys, PTSD prevalence ranges from a low of 0.3% in China to 6.1% in New Zealand and varies from country to country. So it's important to realize that, like many other mental illnesses, it's something that is dependent on cultural aspects of it. And another thing that's important to remember is that not as many people in the military have it as you might think, in that the percent of people in the military diagnosed with PTSD is not that much higher than the average percent of people from the general population diagnosed with PTSD. It's also important to remember that many people have PTSD from other traumas, and that not everyone who has PTSD has served in the military. So, the criteria for PTSD diagnosis, the first, criteria is exposure to death, threatened death, or actual threatened or serious injury in one of the following ways. And so these are the same things that we looked at earlier that deal with trauma exposure. The next criteria for being diagnosed with PTSD is that the trauma is persistently re-experienced in one of the following ways: intrusive thoughts, nightmares, flashbacks, emotional distress after exposure to traumatic reminders. So that's where you talk about triggers, things that remind you of what happened, and physical reactivity after exposure to traumatic reminders. So an example of what these traumatic reminders can be is offered here.
Once I got back home, I was driving. I did a lot of driving when I was over there, almost every day. And so driving here is a lot different than driving over there. Over there, you avoid every pothole you possibly can because who knows what's inside of it. Here, usually a pothole is just a pothole. A bag of trash or something beside the road here is usually a bag of trash. Over there, who knows what's inside of it. So you swerve, stuff like that. For a couple of months, I did that here. Even still, I kind of look at things like, well, what's that? Your heart races, or mine does anyway. My heart starts to race. Things tighten up, muscles tighten up. I actually start looking around, almost like I'm looking for a trigger man. Stuff like that, and I try to swerve away from it. Get on the other side of the road, stuff like that. But yeah, little things like that, and it's like.
So, the third criteria is avoidance of trauma-related stimuli after the trauma. So that would be trying to suppress or avoid trauma-related thoughts or feelings or trauma-related nightmares. Additionally, two required symptoms are from negative thoughts or feeling that begin or worsened after the trauma in terms of inability to recall key features of the trauma, overly negative thoughts and assumptions about oneself or the world, exaggerated blame of oneself or others for the trauma, negative affect, decreased interest in activities, feeling isolated, and difficulty experiencing positive affect. So those are usually results of having trouble post-trauma, as most of these are. Then another criteria is trauma-related arousal and reactivity that began or worsened after the trauma. So this is irritability or aggression, risky or destructive behavior, hypervigilance, heightened startle reaction, difficulty concentrating, and difficulty sleeping. There's also trauma-related arousal and reactivity that began or worsened after the trauma in one of the following ways. So that symptoms last for more than 1 month, symptoms create distress or functional impairment, and symptoms are not due to medication, substance use, or other illnesses. And so all of those criteria are required, and with those criteria A through H, if a patient meets all of those criteria, then they could be diagnosed with PTSD. So then within that, there's a dissociative specification where an individual experiences high levels of either depersonalization, so the experience of being detached or outside from oneself, or derealization, which is the experience of unreality, distance, or distortion, so general feeling of separateness from oneself when someone interacts with trauma-related stimuli to get the dissociative specification. There's also a delayed specification where full diagnostic criteria are not met until at least 6 months after the trauma, though some symptoms may occur immediately. PTSD, it's also important to recognize, has a very high comorbidity, which means that about 80% of people with PTSD have another mental illness, which makes sense considering the way that PTSD works as a combination of experience and environment and like the bio aspect of mental illness. So the most common mental illnesses to be associated with PTSD are depression, anxiety, and substance use disorders. So treatment for PTSD is usually involved in a combination of medication and therapy with SSRIs, which are selective serotonin reuptake inhibitors, and benzodiazepines for like Xanax for specific events and like panic attacks, but then SSRIs for long-term brain chemistry. But other courses of treatment are usually cognitive behavioral therapy, or in some cases prolonged exposure, which is where someone might be exposed or re-exposed to trauma-related stimuli for, it usually happens over a period of 10 weeks, and through that re-exposure, they will learn how to work through their reactions to the stimuli. And something that's interesting about the way that PTSD is treated is that it was something that people really began to start looking at after World War I. And so after World War I, Freudian psychology is the prevailing psychological lens, but then also later on you have the rise of CBT. And so people definitely began looking at PTSD by looking at the psychological and emotional aspects of it. But now psychologists, psychiatrists, and researchers are beginning to look into the biological aspects of PTSD more. And so Daniel Pearl, a researcher, recently published findings in the scientific journal The Lancet Neurology that found that in traumatic brain injury cases, a dust-like scarring, often at the border between gray material where synapses reside and the white matter that interconnects it, was found in people with PTSD. And all of the people that they studied with PTSD had the same pattern of scarring in the same places, which appeared to correspond to the brain centers for sleep, cognition, and other brain injury trouble spots. And so, as with many other mental illnesses, researchers are beginning to look more into the biological aspects of PTSD and finding how the biopsychosocial all connect. And so with PTSD being something that's a result of an experience, its medication is effective, but psychotherapy is very effective. And so if this is a graph of effect size and then effects of treatment on PTSD severity, an effect size of 0.8 is something that other people can see. And so with medication, there's a 0.242 effect size, but then with psychotherapy, there's a 1.14 effect size. So again, with the kind of like with the etiology, because PTSD is a result of experiencing a traumatic event, it's a mental illness where psychotherapy is very important for recovery and for reintegrating into society and managing symptoms to work through the trauma itself. So recently, Lady Gaga has begun to speak out about PTSD she has experienced after being raped a few years ago, and this was her speaking to LGBT youth in New York City, and she's begun to work as an advocate for other people dealing with PTSD. And so that's the end of my presentation. It's thank you for watching, and it is important to realize that as with other mental illnesses, it is possible to live with